All right, we got Dr. Prapote from Restore DHT Clinic. Dr. Prapote, thank you for joining the podcast. Please tell us a little bit about yourself. Your experience, your background, how long you've been practicing hair restoration surgery.
Well, it was like over 15 years ago after I have graduated from the medical school, and I furthered my education in master's degree in dermatology, and then I met Dr. Damkar Patomvanish, and I trained with him in the course of the fellowship program of the ISHRS.
For those who aren't aware, which I talk to a lot of Thai doctors, Dr. Patham Vanich is sort of like the godfather of
Godfather.
FUT
Yeah.
in Thailand. I mean, he's basically trained all of the top doctors from Ratchathorn, Lair Wong. I mean, Pasu, all the top doctors have been trained by him at some point in their career. So I think him training doctors and kind of setting them on the right foot is an amazing thing. But he's always been sort of seen as an FUT primary doctor. How do you consider yourself? Do you do FUE? What are your thoughts on FUE versus FUT?
Well, personally, I do both FUT and FUE. For cases that who do not want to shave, we can do non-shaven FUE, and also we can do the FUT. And for small cases, we do FUE. That is the easy one. But for the big area, operating in the big area, we consider FUT for the operation or even combo. And since I have been working with Dr. Patam Vanish, uh, his work is very neat, and it doesn't have to be either FUE, it can be both.
How many cases do you do? I mean, there's this big surge in the black market. As you know, ISHRS has a fight the fight, fight the black market campaign because it's basically exploded in all countries. There's two ways to look at hair mills, right? Some people say that hair mills are any clinic that perform multiple surgeries per day. Others believe that hair mills are clinics that are only technician based and perform multiple surgeries per day. What are your thoughts on that, and how does your practice work?
In my practice, I operate one surgery per day, and sometimes if the case is have smaller number of grafts, we can do it two cases a day. And what I do consultation by myself. I draw the hairline. I am the one who extract the graft out of the patient. Doing the FUT, I'm the one who close the wound. And for FUE, I do the extraction. And on recipient area, I'm the one who do the pre-made incisions, and the nurses can use the forceps to insert the graft into those holes.
So 1 to 2 surgeries per day, I think, is feasible for a clinic as long as the doctor is, performing all of the surgeries and deeply involved doing the incisions, the extractions. If you're doing FUT, suturing, and closing up the suture. Do you have any cases that you'd like to share with us?
So, yeah, I have been asked about doing FUT and how the scar are, and this is like the FUT wound and the scar of the FUT. This is the long-term scar. I think it is okay to have this kind of scars.
I think an FUT scar like this is good. It's a pencil thin scar. I would say that the patient should probably grow his hair out a little bit longer. Like if you're someone who's expecting to have FUT, you kind of have to accept the fact that the hair is going to be a little bit longer than it would if you had FUE. But something like this is still acceptable. This is probably like a number 2 guard, I would imagine.
This is the female case doing the FUT. About after a year, this is the front part. This is the side and the video. Oh, I'm sorry for the voice. This is
Oh, I
the
can't.
video of her.
Yeah, I can't hear the voice. That looks really good. So this is an FUT case for a female, which I've always felt that FUT is best directed towards female or transgender patients because they wear their hair long. They don't want to shave the donor, and it's the most optimal situation for you to have FUT. That video looks really good. I mean, I think it looks extremely natural, and the hairline looks really feathered. Really, really good top work. But I mean, those are my thoughts. I've always kind of been of the thought that FUT is better for certain cases, and FUE is usually, better for men who like to wear their hair short.
The next case would be the men who wants to wear their hair shorter, and yeah, we did FUE of about 1,200 grams.
Yeah, that looks really, really good. Really soft hairline. I like that you did the temple peaks right there, because that I feel like whenever you lower a hairline, you have to have the symmetry and bring in the temple peaks.
A lot of patients come to me and ask for the frontal temporal angle to be rounded than this. And I explain the natural hairline of the male hairline, the sides go higher. And when the results come, it looks okay, it looks fine, it looks natural. The female doing the FUT, 7 months after surgery,
Wow.
she did about 2,400 grams.
That's really good growth for only 7 months. And like I said, FUT for women all day. It makes the most sense. I don't really think there's any benefit for a female to get FUE. I mean, they're never going to wear their hair short for the most part.
Yeah.
And so, yeah, you just shave a little tiny strip, you cut the strip, and then after, if you do like no shave FUT or no shave transplantation, you're literally not going to see anything. You're not going to know that they even had a procedure done. Looks really, really good.
The next one, the male who did FUT for over 4,000 grams, and the post-op surgery pic photo for 10 months after surgery. He did the front part and also the top part.
Ah, I see. Yeah, so he needed to move a lot of grafts.
Yeah, the area was quite large, so we have more graft at the front and less graft at the top part.
That's amazing density, though. Incredible density, especially considering, Asians on average have less follicular units per square centimeter than, let's say,
Yeah.
Caucasians. So if you take an FUT strip from an Asian patient, you're typically going to get less grafts than you would taking a strip from, like, a patient from Sweden or something.
Yeah, that's right. This gentleman did 2 sessions with me. On the left side, this is the before surgery, and this is after the first session. We did the front half. We continue to do the mid scalp on top, onto the top.
And do you have pictures of the second surgery?
We have the after the post op, like years after the second session. On the right side, the photo. Of course, we gave him the medication. He took finasteride and oral minoxidil. There's still some space on the crown, and yeah, he now he wants to do the third session on the crown.
Yeah, I mean, everything looks really, really dense. The crown area for a gentleman, I mean, I don't know his age, but I'm assuming he looks like in the middle age. I feel like crowns are very dependent on age. Like, right? So if you have a 30-year-old patient with the same level of hair loss, he's not going to want to accept that, right? That crown. But if you have a 50-year-old patient, a little bit of a thinning crown is not so bad, as long as the front and the mid scalp is covered. So how many grafts? So he's had 5,915 grafts total.
Yeah,
over 2 sessions. And if you were to do, let's say, combo him out, FUT, one big strip, and then the rest FUE, how many more grafts do you think you can get?
We might be able to get like 2,000, 2,500 grams for the maximum.
Okay, that's not bad.
Yeah,
that would put him at like close to 8,000 grafts all scalp.
yeah.
Which I think that would make a big difference in his crown for sure.
The next case, we did long hair FUE, a little bit over 2,000 grams. The trends of the long hair FUE is more popular these days, so a lot of patients wants to do it. And actually, I prefer the short hair transplant, but if some people come for long hair, we are capable to do that.
There's a more risk to doing long hair FUE because it's easier to pull out a graft
Yeah.
than it would be when it's shaved, when it's buzzed down. So definitely something to consider. The only people who should get long hair FUE are maybe somebody who's like a celebrity and it needs to be on camera and doesn't want anybody to know that they had the procedure done. But normal people, I mean, it just is not worth the risk, in my opinion.
The next case, this guy, we did about 2,600 grafts. The photo was taken after 10 months. We actually did just the front part, and the top part, we didn't do the transplant. We gave him the oral medications, and also he did the injection of regenerate activa. So all the medication helps to bring back his density and thickness at the top part, and the graft at the front part from the hand transplant look good. Another case, doing at the crown area, we did about 2,000 grams FUE and the post-op 8 months.
That looks pretty good. 2,000 grafts for the crown. That's post-op 8 months. So it looks really good. And this is all your work. You did the extractions. You handled everything
And
in terms of the extractions. You created the sites.
And the nurses helped using the forceps to insert the graft into the pre-made incisions.
Well, those are really good results and pretty impressive. I would say that I'm really impressed with the density and the feathering of the hairline. Obviously, you're able to dense pack, which I think is what patients come to expect from now on. I mean, I feel like in the past it used to be having a little bit more hair was okay, but now you really need to have a difference. You need to really have density, and that's really crucial. Thank you for sharing those results. I appreciate you joining the podcast, Dr. Prapote. I look forward to seeing more of your cases on the forum. For anybody who wants to reach out to you and send you an email or questions, how do they reach you?
We have the IG, the hair restore underscore by DHT Clinic.
Okay, so on Instagram, you can find Dr. Prapote at Hair Restore by DHT Clinic. I will go ahead and link it in the description. Do you feel comfortable sharing your email for anybody who wants to send you questions or consult with you?
Oh, yeah, sure. prapote@gmail.com.
Perfect. Thank you so much, Prapote, for joining the podcast. Like I said, I look forward to